Good morning. It's October 17th, Sunday, October 17th. So, just want to give y'all a little history of lymphoma. I was diagnosed large B cell, diffuse large B cell lymphoma back in um, February 2020. So, I got sick in August of 24, and I got sick, had fever, chills, no appetite, fatigue, tired, and I was at work. I was so tired. I just took a nap before going home. So I was working overnight. I work overnight. And at the time I had digestion issues, which started back in 2020 also. So any little thing I eat, breathe air, I had to go to the bathroom. So I thought it was my stomach. I usually get flare-ups and fever and all this, wanting to, feeling nauseous. So that kind of helped. So when I got home, took the medication for my stomach issue. Um, kind of pushed my way to get to work. When I get to work, I didn't even clock in because I was so discombobulated and like walking crooked. So when the EMS arrived, I had 103 temperature. They was giving me fluids. I got to the ER. I was sepsis, meaning I had a high fever, um, which comes with chills and the fatigue, the tiredness, no appetite. High fever, my blood pressure and heart rate was abnormal, usually high, and those are the symptoms you can see, right? Right there. And it didn't take no time for me to get like checked in, I guess you could say, registered in the hospital. I was hospitalized. So they took blood work. I had no white blood cells. They, no neutrophils, which I know now. That helps you fight infections. So, so, so I had to get admitted and tested positive for COVID. So I had to stay, and also with my diagnosis, um, I guess because my immune system was already compromised with cancer, with the lymphoma, I couldn't fight the COVID infection. I had, shortness of breath. So if you are constantly getting sick and having infections, you probably need to go get checked out. Get checked out. Just go get checked out. That's just my advice. So when I got diagnosed with lymphoma, I didn't have fevers, I didn't have chills, I didn't have night sweats, I didn't have the fatigue, the tightness. And this goes back to probably early as I can notice like 2010. In 2014, I noticed in my right groin area, there was something there, a little fleshy, inflamed, but it didn't hurt or anything like that. Did some basic tests, gynecological tests, came back, nothing was wrong. 2018, it got bigger to the point where, because I was working in a warehouse, and when I would walk, because you walking across probably like almost 500 yards of, you know, taking pallets and dropping them and whatnot, and I would get um like the elastic in that bikini line area. It was digging into my skin, so I had to rip my underwear or change to boxers. So 18, I noticed it, got diagnosed. Well, went to the hospital, never didn't go back for the follow up. The primary care physician, I was scared. So then 19, I went back, got diagnosed. In February 2020, I'm sorry, in 18, I went to the doctor, but I was scared. So it wasn't until February 2020 they did the biopsy. March 2020 they wanted to do chemo. They had the appointment set for chemo and everything. I didn't want to do it because my mom, she had cancer, the same type. I don't know if it was non-Hodgkin's or not, and she had an aggressive treatment. I think she was going quite often, like a couple of times a week. I only go once every 3 weeks. And she lost her hair, dropped extreme weight, probably barely 100 pounds. And she was like 5'7", 5'8". And she walking like a newborn, her hair gone, you know, phew, it's a hard the treatment is aggressive. The treatment is toxic. So what I'm thinking is my mom probably caught an infection, and they didn't probably have the regimen that they have now back in 91. Maybe they just gave her chemo and not none of the other drugs, like the steroids, the antibiotics. They give pro, prophylactic antibiotics to prevent infection. So, or help you fight infection because your immune is suppressed. So maybe she got an infection, couldn't fight it, and she died. Maybe they didn't want to change her treatment because even in her last stages, where they staged her at stage 4, she could have had a chance if maybe they helped or um, maybe gave a different regimen, like give her a chance to build her immunity, get rid of the infection first, and then let her immune system build back up, then do the chemo. Build the immune system up enough to have her fight the infection, whatever was causing her to be sick, and like fever, like she was having the typical signs. I didn't. I know this can probably be back for me, probably as early as 2010 when I noticed the little fleshy area, the growth. But by this time, by 2018, 19, that growing area was like a size of a tennis ball, like a golf ball. That's what the doctor told me, like a flattened golf ball, which is big. Your lymph nodes can very much get inflamed to huge sizes. So I didn't go to treatment when I was diagnosed. I didn't get treatment. So it's now fast forward to 2024. I get sick with diagnosed with COVID because my immune system was suppressed because of the cancer. My body was having an extreme reaction. So my body is trying to fight and it doesn't have enough to fight the cancer and um the COVID infection. So I was sepsis, high blood